What's up guys, Dr. Kyle Loveless here. I'm gonna help you learn how to pick your healthcare provider today. This is a big deal because I've had so many people come into our clinic and saying, hey, do you have a referral for my doctor because my other doctor I don't like because he makes me do things I don't like to do. How do you pick this healthcare provider? It didn't used to be, or used to be just, the guy down the road and this was your neighborhood doctor and this is who you went to or this is who came to you, and that's how it was. But now there's so many out there, you really need to understand what you're looking for, right? You don't just go to a clinic because that's the clinic in the area. You gotta pick the doctor that you work with. So stay tuned, we're gonna talk about that. Make sure you like this video, subscribe to the channel, and check out the ebook. It'll be in the comments below. All right guys, today we're gonna talk about how do you pick your healthcare provider. Big question. It's a very, very common question I get in our clinic today, that people wanna fire their doctor and get a new one. And I'm talking about the medical provider mostly, but actually, in general, a healthcare provider. It could be chiropractor, it could be acupuncturist, it could be a nutritionist, it could be physical therapist, or what else is there? Personal trainer. Whatever that provider, somebody that provides health for you or health information to you, how do you pick them? Number one, you pick them by saying, do I relate to this person and do I want to spend some time with this person, right? It's really hard if someone, you look at, I don't want to go to a doctor that's that is complete opposite mindset for his life than my life, right? I want this person to help me in my health, in my life. So I'm not going to go to someone that's kind of lazy looking, meaning like they don't put on a perception that they're actually trying to take care of their health. Right? If they're overweight, maybe they smell like cigarette smoke, or maybe you can tell they smoke a lot, or whatever that is, that's not somebody I want to pick as my leader. So in other words, you need to pick your healthcare provider to be your leader, not just because they went to medical school, because they're living what they talk about. That's really big. One thing that we try to do in our clinic, and we talk to our staff even to be in our clinic, we don't let our staff even not at least try to be this way, is we want to be congruent with the message that we deliver. Our deliver is about health our message is about health and healing, and we want you to have, the people that come into our clinic, to have health and healing and understanding health. But we can't, and we can't be on the weekends over drinking Coca-Cola and eating Chick-fil-A, or we can't be sitting around all day long on our computers and not ever exercising, not doing spinal care, not getting chiropractic care. That would be incongruent. So first of all, pick the doctor that is congruent with their message and someone you look up to and want to be your leader in that area and help you have a better life. That's number one. Number two is ask what their philosophy is in life. What their philosophy is in health. And so you have to pick, number one, your philosophy so you can know if theirs is right. But the philosophy, there's two different philosophies in the healthcare world today. Number one, the first philosophy is more of a mechanicalistic way of thinking. Okay, that's going to be your main medical mainstream thinking. Not all medical doctors think that way anymore, but a lot of the mainstream medical, this is how they're taught in medical school, in other words, is that our body is something that needs help. It needs medical intervention, meaning when we're born, we're going to need a vaccine, right? We're going to need something externally from a doctor that's typically petroleum-based and chemical filled, just what it is, pharmaceutical industry, and they're going to help our body heal itself. We need a cure. There's got to be a cure out there. That's the first philosophy, is that our body heals from the outside in, and that it needs help from something out externally to heal us, right? Right? It's not internal. It's not, essentially, we don't have this innate ability to do things on our own. Second, there's different variances of that concept. The second philosophy, which is what we use in our clinic and how we see life and I see health, is that our body was wonderfully, powerfully made. It doesn't, and by the way, you can be a Christian medical doctor and still live over here, or a Christian healthcare provider, and still be in this philosophy. It's not just about God making the body. But over here, we say that God made our bodies wonderfully, powerfully made. It doesn't need help healing. It just needs no interference. That it heals from above, down, inside, and out. Meaning there's nothing I can give you that's going to heal you. There's nothing I can give you that's going to cure you. I don't even like the concept of treating something, because all we're truly doing as a healthcare provider, and this is the philosophy that I think is great, and this makes the most sense to me. If it does for you, you want to see if this is your doctor that thinks this way, is that our body doesn't need help. We're here to remove the interference from healing, and we're here to teach. The definition of a doctor is teacher. The doctor should teach you how to become your own health expert, and teach you to be someone that can make their own healthcare decisions. And so that philosophy is that the body doesn't make mistakes. That philosophy is that there's an innate healing power within the body that God placed there from the day the sperm and the egg came together. boom. And they've actually shown video of this happening. I don't know how they did this, but it's like a splash of light. And God put a soul in there. He put this life in there, and it was made to do everything the way it's supposed to and adapt and heal and do everything right. And you can question that and say, well, why does this happen? Why does that happen? Well, because there's interference. We are great as humans and people in this world at creating interference to the stuff that God put in place. Look at Adam and Eve, right? So what happened there? Well, he said, don't eat from the tree, right, of good and evil. Why did he do that? Because they had good, they didn't know evil. And so they came in and said, okay, we're going to eat from that tree. We're going to let the serpent, who Adam actually named, right? And he said, God said, you're in control of this serpent. We let the serpent come in and get Eve to eat that apple. And then Adam, he didn't eat the apple. He didn't first make that choice to eat the apple, but he didn't say anything about it. So his silence was his sin, right? So he went ahead and let that happen. And then next thing you see, God comes into the garden and says, where are you? It's about the relationship has just been shifted, right? Where are you? You've interfered with this perfect relationship I created here. Where are you, Adam? And Adam comes out with an olive leaf on and says, I'm right here. And why did he have to make up new rules? Why did humans have to make up new rules to the law that God already put in place? Well, they had to make up new rules because now they were scared, because now they knew evil. And my whole point of that is that quit interfering. Let God's power that he made take care of us, and the interference is there. Some of these interferences we can't control, and so I'm not saying that we're in full control of that. There's aluminum in our atmosphere. There's things that can happen we can't control, right? But why add interference? And so this philosophy over here, your doctor should have a philosophy that your body's made to heal itself. His job is to support the healing, remove interference, let your body do what it's supposed to do, and listen to you. And that's the next step, is get a doctor that's going to sit down and listen to you, not just tell you all the things you need to know and all the things about yourself. Our consults are usually 45 minutes to an hour. We just sit and listen. Just listen, right? And I call it letting the line out. I just let the patient go and go and go. What else? What else? What else? Because the more information I have, the better I can help them, one. And two, it builds trust. No one can help you if you don't trust them. So you have to be able to trust your doctor, and that comes from him or her sitting and listening to you. So they need to be able to listen. They need to have a good, strong philosophy that you align with. And maybe this is your philosophy and this is your doctor. I'm not saying which to pick. I'm telling you what I agree with and what I think is the most valuable way to pick a doctor. Okay, the next step is your doctor going to be someone that has an agenda? Are they related to any kind of other agenda? Like, are they related to a pharmaceutical industry? Meaning, are they listening to that pharmaceutical rep coming in all the time? Do they have a higher power, like a hospital, that tells them they have to meet a certain quota by the end of the month? Are they getting bonused for you getting certain testing? Are they getting bonused for you getting certain treatments? Okay, that's an alternative motive, even if they don't want to have it. Money is a strong thing, so it'll pull them away from that. Having a job is a strong thing. If the doctor can only spend 7 minutes with you, which is what a lot of hospitals require, I know because I've talked to them, then it's hard to trust that doctor if he's really working for them and not you. And so picking the doctor that's going to work for you and not the industry that he's in is the final thing there. And finally, a doctor that you know is actually going to teach you. So a doctor, I said again, is a teacher. He should be teaching you how to be healthy and sticking up for your family in terms of their long-term health. Okay, not a pill prescriber, not someone that's just going to say, here, take this. And this could be natural stuff too. You don't want to go to someone that's just simply going to say, oh, you're going to need all these supplements for you to be healthy and to heal you. Now over here we can say, you need some vitamin D3 because your body's going to be deficient in it, and without vitamin D3, there's going to be a problem. That's different, but not this is going to heal you. It's even the way we talk is different. So that's how you pick. That's my big picture on how do you pick a good healthcare provider for you. You got to trust them. They got to listen to you. They need to have a good philosophy of what health actually is. And they need to be someone you look up to and say, hey, I would like to have the health life that they have. I'm going to let them lead me and my family in their health. Okay, so hopefully that was helpful. I thought it was just a really cool concept because I have so many people asking me, how do I pick my doctor? How do I get a new doctor? Well, it starts with you knowing what health is and you knowing your philosophy in terms of what you want a doctor to provide for you. All right, hope that was helpful. You guys have an awesome day. Make sure you like and subscribe to this channel, and we'll talk to you next time.